everyone, my name is Silvia Pinzon and together with my partner Andrea we are going to present an analysis about stakeholder communication in Clínica Foscal, a leading healthcare institution located in Bucaramanga, Colombia.
In this presentation, we will explore the organization's background, its key strategies, the main challenges it has faced, and our stakeholders mapping based on the influence interest matrix.
Clínica Foscal, founded in 1973, is one of the most recognized medical centers in Colombia. It provides a wide range of health services, including general medicine, specialist surgeries, diagnostic imaging, and research in medical innovation.
The organization is committed to humanized care, technological advancement, and social responsibility. Its mission is to improve quality of life through efficient, ethical, and patient-centered healthcare.
Foscal's growth strategy focuses on innovation, continuous improvement, and strategic alliance. Over the past decade, it has expanded in service through Foscal International, integrating research, teaching, and medical assistance under one model.
The clinic has also strengthened its corporate communication strategy to maintain trust among patients, employees, partners, and the community. This is based on transparent information, effective internal communication, and digital transformation.
Like many healthcare organizations, Foscal has faced several communication challenges. The main ones include 1. Ineffective transmission of internal messages to employees. 2. Lack of feedback mechanisms for continuous improvement. And 3. Limited innovation in communication formats and tools.
These issues affected employee engagement and the flow of organizational information. In response, Foscal implemented new strategies such as digital bulletin boards, interactive training sessions, and an internal communications platform to strengthen dialogue and participation.
To address these communication gaps, Foscal applied the principles of two-way symmetrical communication proposed by Gruning and Hunt, focusing on listening, participation, and transparency.
They also developed a feedback plan that allows employees to share suggestions and report communications issues directly to the internal communications department. This helps to build trust and foster continuous improvement.
Based on our research, we identified the following key stakeholders of Foscal. 1. Patients, the main beneficiaries of the organization service. 2. Medical staff and healthcare professionals, responsible for providing care and maintaining service quality. 3. Administrative employees, support the organization's daily operation and internal communication. 4. Suppliers and strategic partners, ensure the provision of medical equipment, technology, and logistics. 5. Community and families, indirectly impacted by clinic service and social programs. 6. Regulatory entities, oversee compliance with health and safety standards.
We use the influence interest matrix to classify these stakeholders according to their level of power and engagement. Quadrant, stakeholder, description, and communication strategy. This table represents the influence interest matrix we designed to Clínica Foscal. It helps visualize how each stakeholder relates to the organization based on two main variables: their level of influence, meaning their power to affect decisions, and their level of interest, which reflects how much they are impacted by the organization's actions. In the first quadrant, we place medical staff and patients who we both hide influence and hide interest. They are essentials for Foscal's success, so communication with them must be constant, transparent, and two-way. In the second quadrant, with high influence but low interest, we identify regulatory entities and health authorities. They hold decision-making power, but their interaction is mostly limited to complaints and reporting. Therefore, communication should be formal, concise, and focused on regulations. In the third quadrant, we low influence but high interest. We include families and the community. They are directly affected by FOSCAL service, so the institution keeps them informed through social media, health campaigns, and community programs. Finally, in the fourth quadrant, we have suppliers and the general public, who have both low influence and low interest. Although their involvement is limited, it's still important to maintain basic information flow through updates and newsletters to preserve transparency.
This mapping shows that FOSCAL communication strategy must priority patients and medical staff who have both high interest and influence.
At the same time, maintaining transparency with regulatory entities and reinforcing communication relationships through corporate social responsibility programs is key to sustaining reputation and trust.
In conclusion, FOSCAL demonstrates that effective stakeholder communication is fundamental for organizational growth and reputation management.
By applying strategic communication models and maintaining active dialogue with stakeholders, the clinic continues to strengthen its credibility, trust, and commitment to society.
Thank you for watching our video. Bye bye.
We hope you enjoyed it. Bye.